Well, good evening, everybody. This is Dr. Murray from Murray Natural Integrated Health here in Hastings, Nebraska, and we are doing a video for here tonight on thyroid hormone. Stop the thyroid hormone madness. There are so many people that they go in and they have different tests done, and they go in, they go with different complaints, and they come out and everybody says, hey, your thyroid is normal. We don't see anything wrong. And they have these tests done and they say everything's okay. Well, we're going to talk about that here today, especially from the standpoint of thyroid and thyroid hormone testing. Next week, if you stand by next week, come back next week at the same time, we're going to talk about the intersection between thyroid hormone and also sex hormones, because we know that there's a huge connection between those, and the cortisol and the adrenal connection is, of course, the big connection between those two. So we want to make sure that you stay tuned for that and make sure you do come back here next week. So we got lots of information to go through some different case studies today, talk about different types of thyroid tests that are important for us, for everyone to have done, and to not mitigate the importance of those. Like and subscribe to our page. We got lots of good case studies as well as good health related information for you to look on there. Need to make sure you are doing that. It is important that we look at the conservative options that are out there, that you and I can be involved in daily, that can help us to become healthier, to have optimal health. That's one thing I always tell patients: the reason why we are being healthy, the reason why we should try to be healthy, is so that we can live with optimal health, and so that we can serve more, do more for our family and friends and all those things. So let's jump in a little bit of introduction about me. So as a certified medical examiner, as well as a naturopathic physician, as well as a doctor of chiropractic, we do a lot of objective science-based testing in our office to get to root causes of problems. And from laboratory testing, blood work, EKG, spirometry, a variety of different tests, from stool tests to saliva testing, also heavy metal testing, etc. You can get to the root causes of problems. So we've been here in Hastings, Nebraska, like I said, since 2008. And so a lot of good information to provide you here today. Again, like and subscribe. And the reason why that's important is because, if you like and subscribe, you can also make sure you get notified of these videos here, but also you can comment and those things as well. But we want to make sure that you get all the relevant information. So make sure you do like and subscribe to our YouTube page there. Okay, so let's continue on here. In our office, like I said, we do a lot of medical examinations. We do EKG as well as spirometry, laboratory testing, supplements, of course, just a variety of different tests so we can get to root causes of problems. We also do ultrasound. So even with thyroid, with the butterfly-shaped gland here, and we're talking about that mostly here today, there's lots of good things you can get from imaging. And it's also, if you have a thyroid disorder, it's also good to kind of look pre and post and see how those things have changed. So many different providers' offices, they might ultrasound that one time, but are things changing? Are the cysts, are those enlarging or not? When we're doing point of care ultrasounds, we can actually look and we can see and objectively measure whether those things are improving or staying the same. And so this, I'd like to start off when I'm doing these as kind of a good case study, showing you, really giving you a good idea of why it's important to utilize conservative-based care. So this individual came in and they had chest pain and also difficulty breathing. Now, they had a previous heart stent procedure. And so I'm automatically thinking, hey, this isn't good. This person has, perhaps a heart problem. And so I referred them to a cardiologist, but they didn't want to go there and do that at this point. So we did some nutritional testing, and we found also their blood pressure was elevated. But in our nutritional testing, and we did some laboratory procedures here, and we found that on the first reading there, their A1C was at an 8.8. So they're in a diabetic range. They didn't know they're diabetic. And we see all their liver enzymes are elevated. The ALT is elevated. Cholesterol and some inflammatory markers were elevated. And so what we did with them is we dealt with their deficiencies. They had some vitamin D deficiency. They had also some inflammatory markers. Some omega-3s were off. We dealt with their diet and no medications whatsoever. They brought themselves out of a diabetic range just several months later down to a 5.4, and their inflammatory markers came down. Their testosterone levels actually came up about 100 points. Their liver markers improved. Their inflammatory markers were improved, and no medication whatsoever. This is the point. If somebody tells you that you can't do anything about this is in your genetics, you can't do anything about it, you can't change your genes, but you can change the environment that your genes are manifesting and working. This individual did a great job. We dealt with the deficiencies. We dealt with those things, had a lot of improvement. And that's the reality, is that you can do things to get yourself healthier. You just need to give your body what it needs and take away what it doesn't need. And their chest pain went away, and their numbers, they were able to keep their numbers down for many, many years after that. Through testing, we've seen that. So that improved. Their blood pressure improved, dramatic improvement in their overall labs, and they were stable 2+ years after that. So, but unfortunately, that's not the kind of conversation we have with a lot of providers, a lot of experiences the patients have. They go into their provider and their doctor says, well, you know what? Your blood tests reveal that nothing's quite bad enough yet to need treatment. And the patient says, well, what do I do now, doctor? And the doctor says, well, just do what you've been doing. Come back later and we'll draw your blood and see if it's bad enough for treatment. And the patient says, well, is there anything else I can do to get myself well? And the doctor says, nope, just keep doing what you're doing. That is an unfortunate type of conversation that many patients have had with their providers, because their lab work, it's not bad enough yet. They're in what they call clinical ranges, clinically normal. And so they're not doing the adequate testing, and they're not also looking at the adequate ranges. And this regarding thyroid is point number one right here. The studies that are showing that even subclinical hypothyroidism, that is just a little bit of hypothyroidism that's not quite reaching the clinical manifestation where the TSH and the T4, because we're going to talk about thyroid numbers today, but there's not quite bad enough to reach that. But even those that have subclinical hypothyroidism, where their thyroid numbers are not quite bad enough to necessitate giving them medication for that, it still is affecting their cholesterol levels in this particular study. And if it's affecting your cholesterol levels, and what that means is kind of affecting your liver, and your liver, how it synthesizes and converts some of your cholesterols. But if it's affecting your cholesterol, it can affect your entire body. And that's why it is important for us to not just look at that clinical range. So many times they look at that TSH, or the thyroid stimulating hormone. They look at that one particular test, and they say, oh, it's clinically normal. And they don't look at anything else. Maybe look at your T4, look at your TSH, maybe your T4, but it's not clinically off. And then they just go on. They say everything's fine. And yet it's still very likely, just like the study showing, it is affecting your physiology. It is important. So that's what we want to look at, optimal ranges, because our healthcare system, we need a health revolution. We need to actually look at those optimal ranges and not just look at the cookie cutter approaches and just look at just those one or two tests. If you've got fatigue and you've got weight gain and you've gone back and they say everything's fine and you're still having symptoms, you got to look at more. You have to be your own best advocate. You have to ask the question. You have to kind of push them at times and say, hey, would you please look at more of this? Because they can. Because the difference between TSH and T4 in terms of testing, or how about T3 and reverse T3 and antibodies, all those things, it's in the same tube. It's just simply marking a checkbox on a form is all it is. It's all it is. So let's get down to it, talking about the thyroid. So when individuals have hypothyroid or hyperthyroid concerns, remember that your thyroid hormone is your body's major metabolism mover and shaker. And when it is off, just like I talked about, that even if it's subclinically off, it's not even clinically way off, but it's a little off, it most certainly can affect your function, your entire body, including your ability to metabolize and convert your cholesterols, and can affect your cholesterol levels. So if it can affect all those kinds of metabolism, it obviously can affect how your body is gaining weight or losing weight. It can obviously affect whether or not you have fatigue or not. It can obviously affect whether or not you have dry skin. It can obviously affect whether your digestion is moving the way it should. And the fact of hypothyroidism or low thyroid function, where your thyroid is not producing enough thyroid hormone, classically, those are kind of the symptoms. You're wore out, you've got dry skin, and you've got weight gain and constipation. Those are kind of the classic symptoms. On the other side, where your thyroid is hyperfunctioning, working too much, you may have nervousness and frequent sweating, weight loss, rapid heartbeat and rapid heart rate. Also, blood pressure may be increased there as well. And you might also be fatigued. You might have fatigue. So the same person, the same symptom, fatigue, could be with somebody who has hypothyroidism or hyperthyroidism, either one, because you should have a normal amount of hormone. You should have a normal amount of hormone. So this is a test you can do at home. Very interesting, easy to do. It's not conclusive, but still it's something you can certainly do at home to kind of check. This is one I like giving tips during these presentations. So here's a tip you can do at home. Test your thyroid at home. One good way to help determine how well your thyroid is working. So you can go ahead and check your oral temperature in the morning, arising and again at noon. And it should be around 98 degrees Fahrenheit in the morning, around 98.6 at noon. But if the average first morning temperature over 3 days is less than 97.8, then you may have hypothyroidism. Whereas if the temperature is consistently above 98.6, this is an indicator that one may have hyperthyroidism. Now, this is not a replacement for traditional testing. And also for ladies out there, if you are ovulating, that can also affect your temperature as well. So you want to make sure you're not looking at that falsely. But this is a good point. Yes, they'll do these tests at home and they'll say, well, see, I'm fine or I'm not. But remember, not to test is to guess, but to test is to know. When we do objective-based nutritional care here, we are looking at numbers and we're not guessing about it. Somebody, I bet you here if I ask the question, and if you throw in a comment here if you want to, but if you've had your vitamin D levels tested in the past, and tell me if you have, and you've taken vitamin D, many times they don't retest their vitamin D. And so many patients, they take vitamin D, and maybe it didn't go up, and they never have it retested again. And how ridiculous is that? Because number one, it may not be high enough. Number two, it could be too high. You don't want anything to ever be too high. Same thing with thyroid here as well. If you are even taking thyroid hormone medication, levothyroxine or Synthroid, or maybe you're taking Cytomel or whatever you might be taking, is that really affecting all your thyroid hormones effectively? If you are still having fatigue and you're wiped out and wore down and you're not healing properly, etc., you need to have extra testing done, because not to test is to guess, but to test is to know. So the way the thyroid hormone kind of works, I have a kind of a neat little story on this, maybe a little levity for the night. But first you have your thyroid, of course, produces thyroid hormone, and that thyroid is right about here in your neck, and T4 is produced. And then it goes around your entire body, around your lungs and your liver and your kidneys, primarily liver, but all these organs in your body gets converted into T3. And then it comes back up to your brain. All this comes in your bloodstream, comes on up to the brain, and the pituitary, which is kind of up in your brain. It's at the base of your brain, actually. It's not a part of your brain. But the pituitary, the anterior pituitary, actually produces thyroid stimulating hormone. So if there is not enough T4 and T3 coming up to your brain up in here, then your pituitary will it'll notice that, and it'll make more thyroid stimulating hormone. That thyroid stimulating hormone will come back down to the thyroid and kind of knock on the door and say, hey, Mr. Thyroid, I need more hormone. Give me some more hormone. So if somebody is hypothyroid, or their thyroid is not producing any thyroid hormone, you would expect their thyroid stimulating hormone to be high. because then their brain is saying, hey, there's not enough hormone here. I need to wake up the thyroid and make more. So a little joke here, not too funny, but here's this individual. And I made this through AI, and I asked them to create for me an image with a gentleman who had thyroid hormone floating around in his system and the different organs. And so, but I notice here in this image that there's no T3, there's reverse T3 and there's T4 and TSH. So I asked the question told AI that I wasn't quite pleased with my image here. I said, hey, can you throw in the T3 here? And so he said, sure, we'll go ahead and we'll make that again. Thanks for catching that little piece that we didn't actually put the T3 in there like you like. And so they gave me the same image, almost identical same image. Now, I'm throwing this in as a little bit of fun, but the pituitary looks extremely odd. I mean, it looks grossly like, I don't know, part of the male anatomy. So I went ahead and asked it a question again. AI asked him to change it again. I said, hey, the T3 is not in there. I said, hey, and if possible, can you try to let the pituitary, not look like testicles? So AI, to its credit, you can see here, it says, oh, yep, we're going to do all that and give you a more anatomically dignified pituitary gland. So it did its best. So here's the T3, a neutered pituitary apparently, but TSH back on there, the T3, reverse T3. So at any rate, it tells the same story here that we're saying. And so that's kind of basically how hormones work in your body, how the thyroid hormones work. And like I said, next week, we'll also be talking about sex hormones and the connection and the interaction between your sex hormones and thyroid function. But this is a good point. What is reverse T3? Many people have had their T3 levels tested, right? As some people have. Almost everybody, if you go and you look, let's say you go to a health fair or even at your physician's office and they've had your thyroid testing, most commonly they're going to test one or two numbers. Those two numbers are TSH and maybe T4. Almost never T3, and like never reverse T3, and hardly ever your thyroid antibodies. So what is reverse T3? Well, this is from Mayo Clinic, and they specifically say that reverse T3 differs from T3 in the positions of iodine atoms attached to the aromatic rings. The majority of reverse T3 found in circulation is formed by peripheral deiodination, which is removal of iodine from the atom. That's a good point to make, that the difference between 3 or 4 molecules, or difference between T3 and T4 rather, is 3 or 4 molecules of iodine. I mean, roughly. So iodine is really important for thyroid function. We'll talk about that next week. But increased levels of reverse T3 have been observed in starvation, anorexia, severe trauma, hemorrhagic shock. Basically, when you are in states of stress, your reverse T3 is higher and it slows down your metabolism because reverse T3 is somewhat inert. So it does not positively affect your metabolism. So it interacts and prevents regular T3 from binding, and regular T3 has a lot of metabolic activity. And that leads us to a particular syndrome called erythroid sick syndrome. And this is all about reverse T3. You can have people when they are in a state of stress, and that state of stress could be an injury, could be an extreme illness, could be extreme fight or flight. What other kinds of stress events do people have throughout their day? Some people have a lot of stress at work. Some people have a lot of stress at illnesses. Some people have a lot of pain. Some people, their stresses could also be chemical exposures and toxicities. Could be any number of things. So these types of stresses on our body can affect the conversion of T4 into T3. Reverse T3, which is largely an active form of thyroid hormone, is instead created in these cases. And this inactive reverse T3 and the lowering of normal levels of T3 then affect metabolism. So reverse T3 is an important one to check. If you have somebody that their TSH levels are normal, their T4 numbers are normal, and they're still having fatigue, you need to look. Why? Because not to test is to guess, and to test is to know. So there's your reverse T3. So what is a complete thyroid test? Because so many times you'll go in and they will test, like I said, your TSH or maybe your T4. Some specialists may also test your T3. If you are taking levothyroxine or Synthroid, you are taking synthetic T4. And it is the hope of your providers that you will convert that T4 into T3 effectively, and you won't convert that over into reverse T3. Remember, you don't really want that to convert into reverse T3. And if you are making a lot of reverse T3, there's some kind of problem. There's some kind of stress that's present, and you needed to get to the root cause of it. So a good complete thyroid test, if you're tired, wore out, have thyroid concerns, etc., you need to look at the TSH, the T7, the T3 uptake, the total T4 and the total T3, and the free fractions of those things. Your reverse T3, the thyroid antibodies, the TPO antibodies, and the thyroglobulin antibodies. These are your body's immune system. Your body, how your body is potentially attacking your thyroid. So around 80% of those who have a thyroid condition, around 80% have an autoimmune condition. Their body has attacked their own thyroid. And if you have all your thyroid numbers normal in terms of your TSH, your T4, and your T, let's say your T3, your reverse T3, and all those things are completely normal, but your antibodies are still high. The antibodies are tested in the exact same vial, just like this. If they're high, then it's your immune system is still elevated. So it's like you're walking around with the flu all the time. It's like, and some people say, well, you know what? I don't understand it. My physician doesn't understand it. I'm taking this thyroid medication and it says my numbers are controlled. They're normal, but I'm wiped out all the time. What are your antibodies doing? What are your antibodies doing? 80% of those who are taking levothyroxine or Synthroid, they have autoimmunity, and it's important to look at that. The last one we have down there, Epstein-Barr virus, you can barely see it on there, so apologize for that. But there are a lot of convalescent infections or viruses that are associated with autoimmunity. During COVID, there was lots of discussions about that too, about that affecting thyroid function, also affecting sex hormone function. But Epstein-Barr, cytomegalovirus, lots of these others have been implicated as to being involved in autoimmunity. And there's multiple studies regarding that too. That isn't just implicated. They're there during these. Well, guess where this lab came from? Well, here you got it. You've got the T4 all the way at the bottom. This is a health fair. So this health fair, just like I said, they tested the T4. The T4 was low. This individual brought it in, but they didn't have, look, there's no antibodies. There's no TSH on this either. It's a very, very simplistic lab, and it does not tell the whole picture. Traditional thyroid management, we kind of discussed that just a little bit already, but TSH, it's high or T4 low. Usually they're going to recommend Synthroid or levothyroxine. T3 is usually not evaluated. If it is, some specialists will sometimes offer like Cytomel, some other T3 analog. Reverse T3 is rarely even acknowledged. Boy, I'll tell you what, I've been yelled at on multiple platforms saying that reverse T3 has any bearing at all, but I've already shown you what some of the medical institutions, including Mayo Clinic, they acknowledge it's there, and nobody wants to test it. Not to test is to guess, a test is to know, and it does have bearing. It is important. The cause of thyroid imbalance is rarely investigated. They rarely look at the antibodies. They rarely look at that inflammation that's going on in the thyroid. Rarely do that. Rarely look at it's an inflammatory status of the body. Immune system is involved, toxicity, deficiencies, etc. Normally, they don't look at any of those things. They don't look at those. What's the purpose of the goiter? What's the purpose of the autoimmunity? What's the why? Here's an individual came in. They came in originally with their TSH elevated. Remember, if the TSH is high, that's usually an indicator of hypothyroidism. So they had a long history of elevated TSH. We worked with them. Their TSH came down. The second test, they're at a 5.4. And you see on the bottom test, their TSH is down to a 3.4. And so they obviously have a lot of improvement there. And if your TSH, your thyroid hormones improve, that means that your cholesterol levels can improve. That was actually what that study was earlier. I showed that thyroid function, even subclinical, even like not even the clinically off ones, can affect cholesterol. So it's important. Thyroid case number 2 here. So here we've got the individual, the TSH is high, and we also have the thyroid peroxidase antibodies on here. Now, again, if the TSH is high, we should expect that we should find probably the T4 level. Some of the thyroid hormone levels should be low, and the T4 is low. So the brain is doing a good job, or the pituitary is, at saying, hey, I need more thyroid, make me more. But the TPO antibodies down there, that 233 being very high, the immune system is attacking the thyroid. Their vitamin D levels of 28.5. So we see on here in retest, vitamin D levels, of course, we bring that up. That's easy. And the TSH, we bring that down to 3.8. So they're improving. In fact, you can see that too. The TSH has come down. And what has happened? The T4 has come up. No medication. This person hasn't taken any medication at this point. They just, we've given them some over-the-counter supplements. We've given them some vitamin D, as we show there. You give the body what it needs and you take away what it does not need. This individual also, we did also some food allergy testing. It's all about immune system burden. If you can take some burden off the immune system and reduce some foods that a person should not be consuming, then that takes a stress off the immune system. That's modulating different TH reactions in the body. And perhaps I'll talk about that another time. But you can modulate your body's immune system reactions to by addressing the ones you can address. Another individual came in here. You can see the TSH is high. So if TSH is high, they have hypothyroidism most likely, and the T4 is low. And this person had, of course, a lot of fatigue. They had puffy eyes, a loss of the lateral eyebrows out here. And working with them for 3 months, you see the TSH come down. This is no medication. The T4 is improved, obviously not in any kind of clinical range. If you give the body what it needs and take away what it doesn't need, the body's better able to heal, repair, and self-regulate. Do you think this might affect the way this person feels? Of course it will, because the thyroid affects everything. And by giving the body what it needs, the thyroid can improve, the TSH can improve, their energy can improve. One more, I think I have one more here, maybe one more after this, because I know we've got to conclude here in just a little bit. Try to be mindful of your time. Might be another 10 minutes. But this individual came in, no symptoms whatsoever. And so they had done a previous test of their other provider, but they didn't do. All the provider did was just test their TSH, and they only did that TSH here just about 6 months previous. And they missed it. This person, their TSH was low. This person has Graves' disease, and their T4 is high. They're hyperthyroid. In this case here, what we ended up doing, of course, we looked at some toxicities. They have hyperthyroidism. You can see also the thyroid antibodies there as well are elevated. So we dealt with their autoimmunity and also dealt with their toxicity issues. And we see that they had high uranium in their hair. Do the math on that. You go and look it up and see uranium has a negative impact on the thyroid. And in Nebraska, uranium is elevated. You can go look at the state of Nebraska website. If you're around the aquifer, by the way, it's a good probability that you could have high uranium levels. So that's a good thing to have tested and assessed. And so causes for low thyroid conditions. This is what we're going to talk about more so next time. So there's, of course, the Mayo Clinic. They acknowledge that around 80% of all low thyroid conditions in particular are of an autoimmune nature. We already discussed that. Medications, iodine deficiency can also cause low thyroid. Surgery, also, of course, removing your thyroid can cause low thyroid. Doesn't that make sense? Thyroiditis from other immune system dysfunction, viruses, pregnancy, allergies can be related to thyroid conditions. Environmental exposures and smoke and water supply, all those things, That's kind of the stuff we're going to be talking about next time. So make sure you like and subscribe to our page so that you can be notified about next week's live stream, which is going to be Stop the Hormone Madness, addressing the why, which is important. And so this is, we're going to be looking at the segue or the connection between the sex hormones and also the cholesterol, the adrenal function, and its connection to thyroid function and reverse T3 and a lot of those matters. Last case study, we actually brought this one up last time. This individual, they were taking ibuprofen quite a bit. You can see their GFR, their kidney function number is at 44, which is low. Below 60 is not a good thing. But you can also see their thyroid function. You can also see that that's off there as well. So their thyroid, their TSH is elevated. So they have some hypothyroidism. But what we did is had them remove and eliminate, of course, their ibuprofen. And fortunately, that improved. Their GFR came up into normal levels. So another little point, you want to make sure you're trying to reduce or eliminate any of your ibuprofen. But their TSH, we're able to bring that. Now, we also moved them too far into a hyperthyroid range. But still, it's most certainly possible that you can change and get numbers going in the right direction, even without medication. Some people need medication. It's a fallen world, and we refer people out for medication all the time. But it is amazing what the body is able to do when you give it what it needs and take away what it doesn't need. And that's the point here, is that the conditions that we look, there's these individuals' conditions, their conditions weren't necessarily treated. The treatment protocol focused on removing some of the interfering factors and supporting areas of deficiencies and allowing the body to heal, repair, and self-regulate. This is true healthcare right here. This is true healthcare, not just sick care, but healthcare. We need to focus on disease prevention and supporting our own immune systems, our own body's natural ability to heal and repair, and not just trying to find a pill for every ill. So this is a question to ask yourself. Why is your metabolism sluggish? Is your body deficient in a hormone? Maybe it is. Is it deficient in anything artificial? No. Or is it more likely that there is some aspect of your physiology that is being impacted because you are being exposed to something bad, or you are deficient in a vital nutrient? That is very possible. Perhaps you do need some type of hormone. Maybe that's possible. Well, not to test the guess, but it's very possible that you need something else, because most people are vitamin D deficient. We do testing here. If you're not taking vitamin D, most people are deficient. Most people are also deficient omega-3s. You ever had your omega-3s tested? We test it all the time. And it's a standard lab test that any physician can order from LabCorp or Quest. These aren't, this isn't like hidden science. Anybody can do these things. The T4, the reverse T3, any of your physicians can order those. Those aren't junk or quack science. They're part of any lab, and they're not doing them because they don't want to do them or they can't do them. Their management above them won't allow them to do it. Most do not exercise enough. Most have high animal fat diets. We've got a lot of ice cream, a lot of fried foods, and high carb diets, and they don't eat enough fruits and vegetables. And many have deficiencies in multiple areas. So what areas are you deficient in? What nutrients are you deficient in? And are there perhaps multiple areas of improvement that are possible? So what should you do? Well, first I'm going to talk about that. Eat to live, don't live to eat. Okay, we're concluding. I think I've got one more slide after this. But eat to live, don't live to eat. Decrease your sugars and junk foods and eat more foods by God, not by man. Move, exercise. Find a health coach that will listen to you, will do the testing if you ask them to do it. I mean, hey, at least tell them, hey, if you're saying you can't do it because it won't get paid for, well, then inquire, hey, I'll pay for it. Tell them that. So many times the doctors and other providers I've heard about, they just, no, we don't do that. We don't do that. All it is checking a box on a form. That's all it is checking a box on a form. And also find a provider who will actually help you get to the root cause. And the reason why that we should be healthy is so that we can live out that purpose, that calling, whatever it is. So you can be a better mom, so you can be a better doctor, or be a better, provider wherever you're at. Be a better teacher. or actually a care provider in your home. That should be one of, I think, a more lofty goal for why we should try to become healthy. So anybody who is involved in our presentations, we do have a free hormone checklist evaluation that we certainly provide. So if you are interested and would like to call our office, we would be happy to set you up with that, where we would review a questionnaire with you and talk about different tests that might be of value for you. So you can go ahead and give us our office a call with that. It'd be great. Next week, remember, we have the Stop the Hormone Madness, addressing the why. Like and subscribe to our page here. And I will end by saying this. Find just one thing to get yourself healthier than you were the day before. So many people try to grab on to 50 or 60 or even 20, and they fail. You can find one thing. Find one thing today, get you healthier than you were the day before. And the next day, find another thing and another thing and another thing. Break it down like that. I know you can do it. Check us out on Facebook as well. Murray Natural Integrated Health, setting the standard in natural health care. Take care. Have a blessed day.